Put one hand on your chest. Put the other just below your rib cage. Now take a normal breath. Which hand moved? For most adults, it is the chest hand. The belly barely shifts. That is a completely ordinary way to breathe, and it is also a missed opportunity because the lower hand, the one resting over your diaphragm, is where most of the real work of breathing is supposed to happen. Today, we are going to talk about why that matters after 60, what a daily slow breathing habit actually does for your heart, your lungs, and your nervous system, and how to build the practice in about 10 minutes a day. Here is something worth knowing about your lungs. Even if you have never smoked a day in your life, lung function declines with normal aging. The American Lung Association notes that a measure called forced vital capacity, essentially how much air you can move, tends to decrease by roughly 0.2 liters per decade. Published longitudinal data suggests the rate of decline accelerates meaningfully after age 70. That matters because lower lung function is not just a breathing issue. A large cross-sectional study of more than 3,000 adults age 60 and older found that those with lower lung function face significantly higher odds of functional limitation, difficulty with everyday physical tasks. The relationship was dose-response. The worse the lung function, the higher the risk. The encouraging part is that respiratory muscles respond to training much like other muscles. Decline is not fixed. Something is also happening at the nervous system level. Most adults breathe between 12 and 20 times a minute in a shallow, chest-dominant pattern. That is the mechanical norm, but it is not the physiological optimum. When you deliberately slow your breathing to around 6 breaths per minute, something specific happens. You activate what researchers call the baroreflex resonance frequency, a pace at which your heart rate and blood pressure begin to oscillate together in a way that maximizes a measure called heart rate variability, or HRV. High HRV is a marker of a healthy, flexible nervous system. It reflects strong vagal tone, the parasympathetic rest and digest side of your autonomic nervous system. A 2021 study published in Scientific Reports tested this in both younger and older adults. After just one 5-minute session of slow, deep breathing, HRV improved significantly. And here is what stood out. The benefit was greater in the older participants than in the younger ones. 2 practical outcomes deserve attention here because they are the ones most directly relevant to life after 60. The first is blood pressure. A 13-study literature review published in 2021 found that diaphragmatic breathing at fewer than 10 breaths per minute for 10 minutes twice a day over 4 weeks decreased both systolic and diastolic blood pressure and reduced resting heart rate. A separate meta-analysis of randomized controlled trials in cardiovascular disease patients found a mean systolic reduction of 6.36 millimeters of mercury from slow breathing. That is a clinically meaningful number. It falls within the range of some anti-hypertensive lifestyle interventions. One systematic review published in 2019 specifically concluded that slow breathing may be a reasonable first-line option for low-risk, hypertensive, and pre-hypertensive adults who are reluctant to begin medication. That is a noteworthy conclusion from a peer-reviewed source. The second finding is one that surprises people. A randomized controlled trial published in PLOS ONE in 2026 followed community-dwelling adults aged 65 to 75 through 8 weeks of twice-weekly diaphragmatic breathing sessions. By the end of the study, the breathing group showed significant improvements in balance, gait performance, lower extremity strength, fear of falling, and quality of life compared with the control group. Balance and falling are among the most serious concerns for older adults. The fact that a breathing practice, not a physical therapy program, not strength equipment, produced measurable improvements in these outcomes is worth sitting with. There is a sleep connection as well. A 2025 systematic review in Frontiers in Sleep found consistent improvements in sleep quality across multiple studies using diaphragmatic or slow breathing techniques in adults. Given how common sleep disruption becomes after 60, and given that poor sleep shares the same autonomic pathways that slow breathing targets, this is a natural downstream benefit. Here's the practice. It is simple, no equipment required. Start seated in a chair with your feet flat on the floor and your shoulders relaxed. Place one hand on your chest and one just below your rib cage. Breathe in slowly through your nose. The belly hand should rise. The chest hand should stay nearly still. Exhale gently through slightly pursed lips. That is diaphragmatic breathing. If it feels awkward at first, that is normal. Most adults have been chest breathing for decades. The Cleveland Clinic recommends beginning with 5 to 10 minutes at a time, 3 or 4 times a day while you are learning the technique. Once it feels natural, usually after 1 to 2 weeks, work toward a pace of roughly 6 breaths per minute. That means inhaling for about 4 to 5 seconds and exhaling for 5 to 6 seconds. You can count silently, use a simple timer, or download a free breathing app. No devices required. Your target is 1 to 2 sessions of 10 minutes per day. Morning and pre-sleep are practical anchor times because they attach to routines that already exist. After 2 to 4 weeks of seated practice, try the same breathing pattern during a gentle 5-minute walk. On the timeline, most people notice a calmer, slower baseline breathing pattern within 2 to 4 weeks. Blood pressure and HRV improvements appear in studies at the 4 to 8 week mark. The balance and physical performance outcomes in the PLOS ONE trial emerged by 8 weeks. This practice is gentle, but a few things are worth mentioning. If you have moderate to severe COPD, a recent cardiac event, uncontrolled hypertension, or you are recovering from abdominal or thoracic surgery, please check with your doctor before starting. For COPD in particular, Cleveland Clinic and NIH guidance notes that while pursed lip breathing is widely used in COPD management, anyone with a recent exacerbation or significant airflow limitation should work with a pulmonologist or respiratory therapist rather than practicing unsupervised. During practice, if you feel significant dizziness, chest pain, or tightness, unusual heart palpitations, or sustained shortness of breath, stop and return to normal breathing. Brief, mild lightheadedness in your very first session is common and typically resolves within a minute. If difficulty breathing does not resolve within 10 minutes, Cleveland Clinic advises calling emergency services. Avoid forced breath holds or deliberately breathing past comfortable capacity. Gentle, natural depth is the goal throughout. A standard but important reminder: slow breathing is an evidence-supported complementary habit. It is not a substitute for prescribed medications or medical care. If you are managing hypertension, heart disease, or COPD, let your healthcare provider know you are beginning this practice, especially if you monitor your blood pressure at home because your numbers may change. 10 minutes a day, no equipment, no prior experience. A practice that your lungs, your heart, your nervous system, and your balance can all benefit from. That is the case the research makes for slow, diaphragmatic breathing after 60. You do not need to be a meditator. You do not need perfect lungs. You just need to start paying attention to the hand resting below your rib cage and let it be the one that moves. If this video was useful to you, consider subscribing. We publish new videos regularly on the topics that matter most for staying healthy, strong, and independent as you get older. We keep it calm, we keep it grounded in evidence, and we always try to give you something practical to take away. Thank you for watching. Take good care.